Okay, sorry about that. I don't think I had volume on that one, so I got my mic working now, so I will go ahead and start over again. Dr. John Torres with NBC News here, discussing some headlines that have been going on over the last week or so. In those headlines, I'll go ahead and get below the headlines, get some more information for you, and particularly things you can use with you, your loved ones, and your family to keep safe during this coronavirus pandemic that we're having, and hopefully help end the pandemic. So we talk about those 3 different headlines, and then answer questions that you might have. So if you have questions, please send them our way. We get to as many of those as we can, and they're usually fantastic questions. So please send them our way while I'm talking about the headlines. So let me go over those to begin with. Number 1, vaccine. You've probably heard a lot of news over the last couple of days about the vaccine, what's going on with its distribution. So let me break that down a little bit. So right now, looking at Vaccine Tracker, New York Times is the one I tend to follow that I think is very accurate. They say there are 9 vaccines right now. 3. Those 9 vaccines, Russia has one, China has a couple. Those are a variety of vaccines across the country. Right now, there are over 200 vaccine manufacturers working on what a lot of people are calling the race for the vaccine, hoping to get it out as soon as possible. Maybe by the end of the year, more likely middle of or late winter, early spring of next year. But to date, 9, the 3 we focus on, now there's a 4th one that's going to be coming up pretty soon, are Moderna, Pfizer, the Oxford AstraZeneca vaccine, and Johnson & Johnson, the 4th one. And the reason that's important is because those have entered phase 3 in human trials. And we've talked about this before, how phase 1, phase 2, and phase 3 work when it comes to the trials and approval for a vaccine. At this point, they're not looking at approval in the near future. They're looking at authorization, what's called an emergency use authorization. The difference there being the approval, they go through all phases of these human trials. Phase 1, usually 10 to 20, 30 people, just to make sure it's safe, healthy adults. Phase 2, a couple hundred healthy adults to make sure it's safe and to get some idea of how well it works. And then phase 3 is the big trial. A lot of these are going to be 30,000 people in these trials. In these trials, they look for the spectrum of society. So they want people of a variety of age groups, 18 to 65 plus. Some of these studies are going out to age 99. They look for people with a variety of medical conditions to make sure that the vaccine works for them and is safe for them. And then they also look for a variety of ethnicities. They want to mimic what's happening in society so they can mimic who will be getting the vaccine. So that's where we are with that. Now, you've probably heard some words or some headlines out there about the vaccine being available in October, November, maybe even December, about how it might get this emergency use authorization early. That comes from Dr. Hahn of the FDA saying, yes, they're going to look at it once they start getting data. They might not necessarily wait until phase 3 is complete to get, if they get enough data to understand the safety and the efficacy halfway through or partway through phase 3. In that case, what they'll do is they'll look at an emergency use authorization for people that are at high risk. And by high risk, they mean those that are on the front line of healthcare, those that are directly in the face of somebody with coronavirus taking care of them, those that have pre-existing conditions, or those that are just simply more vulnerable because of their age and their locations. So because of that, they're saying, okay, we might authorize it even though phase 3 is not complete for these people. But for everybody else, we're probably going to wait until phase 3 is complete, look at all the data, and go from there. The reason they're doing that is they're calling it the risk versus benefit. Emergency use authorization, again, that's different from approval. Approval for a vaccine typically takes around 11 years. The record time for approval has been 4 years. This would be emergency use authorization in around a year time frame, which is a very fast time for a vaccine. But you also have to understand that there's been an unprecedented amount of resources put into this, unprecedented amount of scientists and researchers working on it, and we have new techniques. And so that doesn't necessarily mean compromising safety, but it's important that we understand exactly what that phase 3 data is to make sure that it's safe and effective. And that's what a lot of people are calling for. Simply having transparency, having a couple of things done. One, having an independent panel that can look at the data and make a recommendation on the vaccine and when it's ready for emergency use authorization, independent from the government. Number 2, they're also saying, please release the data so anybody can look at it and say, okay, here's what we're seeing. Scientists can get behind it, researchers and doctors can get behind it and say, yeah, it looks good, or we have some questions on it. We're not sure it's ready yet. The important part is that transparency. But as of now, what they're saying is it looks like there could be an emergency use authorization for some parts of the population. Again, the more vulnerable, those working on the front lines, by the end of the year, but for everybody else, probably late winter, early spring, or maybe into the summer. In light of that, a couple things have happened. One, is the government, the National Academy of Sciences, has actually put out a paper saying, and they want comments on it, saying here's how we're going to distribute a vaccine, or here's how we're recommending distribution. And they did it in 4 phases. Phase 1, exactly what I was talking about. These are healthcare workers that are directly taking care of COVID patients. They're also the elderly and those that are more vulnerable to effects from coronavirus, those with the pre-existing medical conditions. Then phase 2 would be essential workers that are in critical fields, those that have some other types of pre-existing conditions that don't necessarily put them at a high risk, but put them at a moderate risk of getting coronavirus complications. Phase 3 and phase 2 would also be teachers. Phase 3 would be children, young adults, and then phase 4 would be everybody else who hadn't got them at that point. What they're saying is if we phase it this way, then we cover those that need it the most first, and then work through the phases until we get everybody to get that herd immunity to hopefully get the pandemic under control. On top of that, they're also working through distribution issues. And you might have heard this week that the CDC, the government, put out information saying, hey, states, we want you to be ready by November 1st to distribute the vaccine. A couple of different sides of that coin there. One is, are they doing this because they think they're going to have a vaccine by November 1st? Is there a lot of political pressure to get that vaccine by November 1st? Or are they doing it just to be prudent? And it's possible they're having a combination of issues going on there. One, a lot of pressure from the government on the FDA to approve one as early as possible. 2, just making sure they're prepared. The last thing we want the government to do is to come out with a vaccine, let's say January 1st, and not having prepared for it. So having been in the military, having been through a lot of preparations, a lot of tabletop exercises, even going to war, one of the things we did is we planned ahead of time. And typically what we would say is, we're not going to have this until February, but I want you to be ready by November, just in case it comes early. That way, once you're ready by November, we can work through the bugs. Of course, the concern is, are they doing this because the government is pushing them towards November? That's where the transparency comes in, making sure that we have an understanding of the data, understanding of the safety and the effectiveness of the vaccine, so we can get input from other groups, not just the government, on what's going on. Because the important part is that the public, the general public, you have good trust in the system, good trust in what's understanding, so you understand that the vaccine is safe and effective when it gets to that point, so you're willing to get the vaccine. Because without enough of us getting the vaccine, we're not going to get to that herd immunity. And without getting that herd immunity, we're not going to get the pandemic under control as quickly. So that's the vaccine. Number 2, colleges. There's been a lot of information about colleges and outbreaks that have happened throughout colleges across the country because of people going back to school. Some colleges shutting down, other colleges sending students home. Well, Dr. Fauci and other experts have come forward and have said, okay, we need to rethink this. Number 1, we should not be sending students home. Once students get to college, the colleges should take care of them. If they become infected, they should be isolated. If they come in contact with somebody who's infected, they should be quarantined. But other students should stay there as well, for a very specific reason. Because if you send students home, especially if they're infected, they're going to go ahead and spread it to other people. If they're asymptomatic infected, meaning they're infected but don't have symptoms, then they can spread that without even knowing they're spreading it. And that's the big concern. They could be taking it to other areas. And so what Dr. Fauci and other experts are saying is simply keep the students there, take care of them there until you can get their infections under control, until you can get the outbreaks under control. That way we're not spreading it to other parts of the country. And they're imploring that these colleges really make an effort to do that, have plans in place to do that. And then the last one is the Labor Day weekend that's coming up. And I, like everybody else, am trying to have a lot of fun this Labor Day weekend, but we need to do it with safety in mind. And here's the reason why. If you look past what's happened in the near past here, a couple things. We look all the way back to Mother's Day. Look, 4th of July, Lake of the Ozarks, best example, over Memorial Day weekend. Every time we've had these weekend get-togethers because of holidays, we've had outbreaks that follow those over the next couple of weeks. We don't want this to happen right now. And so if you are getting together this weekend, it doesn't mean that you can't have fun. It just means that you need to do it prudently. You need to make sure you social distance. You need to make sure you wear masks. If you're sick or you've been around somebody who's sick, then you need to not go to these events. Do these events outside instead of inside. These are ways that we can keep people safe and not have these outbreaks crop back up a couple weeks now, like we've seen over the past couple of holidays when we've had get-togethers and had these things pop up again and start having outbreaks, and particularly the outbreaks that were in the South. Big indicator of what happens when people start getting together and aren't taking those measures that we know work in order to keep coronavirus under control. And again, I'm the last person to say don't have fun, so please have fun, but just do it prudently, do it safely so you can keep yourself safe. Again, going over the different headlines, vaccines, a lot of information about vaccines coming out, phase 3 trials. We're getting closer to the vaccine authorization, and we're getting closer to understanding how distribution is going to work and who's actually going to be getting it in what phases. Colleges, experts are saying if somebody is sick at colleges, students, once they get there, should stay there so they're not taking anything back home with them. And then Labor Day weekend, have a great weekend, but at the same time do it safely so we all keep safe. So now let me see if you guys have any questions.
How long can an asymptomatic carrier spread COVID-19?
So the question is, how long can an asymptomatic carrier spread COVID-19? We don't have the full answer to that, but the thought is that if you're infected with COVID-19, whether you have symptoms or you don't have symptoms, it's usually around a 10-day period. Used to be 2 weeks. Now they've come back and said, the experts in the CDC have said, now it looks like around 10 days. The problem with being asymptomatic is you don't know when you're getting infected. When you have an infection and you start having symptoms, then you understand, okay, I need to wait 10 days, make sure I'm fever-free for 24 hours, and then I'm good to go. I'm not going to be contagious anymore. That's the latest CDC recommendations. But if you're asymptomatic, you don't know when you have it. You don't know when you're spreading it, and so you need to be careful. So whether you've had it, whether you haven't had it, whether you have antibodies, whether you don't have antibodies, regardless, we all need to make sure we wear a mask, we social distance, and we wash our hands plenty of times. Watch those large groups as well, and then ventilate. Windows, keep windows open, be outside instead of indoors. And so again, we don't have the full answer on when asymptomatic people can spread it and for how long, but typically around 10 days.
How long should phase 3 vaccine trials really last?
So the question is, how long should phase 3 vaccine trials really last? And the question is, they should last as long as they need to last in order to get data on safety and effectiveness. The reason I'm saying this is typically what happens, and this is one of the reasons it takes 11 years to get these vaccine approvals, is phase 2 takes a long time. They get 20 or 30 people, they go ahead and give them the vaccine, they follow them for a while, they analyze the data after that for months and months and possibly even years, then they go into phase 2. Phase 2, they have to recruit hundreds of people. It's hard to recruit people, so they get these people recruited, they give them the vaccine, they follow them for a while, and then they crunch the data after that. Then they go to phase 3. You can imagine 30,000 people. Even though phase 3 has been going on since last month, these different groups that have these vaccines they're testing have, at the most, had about half the people they need. They're having trouble recruiting minorities. They're having trouble recruiting older people. They're having trouble recruiting in certain parts of the country. So having that difficulty, the hardest part for them are recruiting enough people. The quicker they can recruit people, the more likely they are to get through this in a much faster way. Doesn't mean they're compromising safety. It just means that they're recruiting people as quickly as they can, getting the vaccines in them, and then following them and crunching the data afterwards. And so that's typically the big delay in these vaccine trials. One thing you've noticed different this one than other vaccine trials is there's been a lot of publicity, so people are stepping up to get the vaccine in the trials to make sure it works effectively, and so that's going to speed things along. So as far as how long it takes to do phase 3, it's as long as it takes, which means it's as long as it takes to get the people into the trial, get them the vaccine. Some of these vaccines require double dosing at either day 21 or day 28. Follow them again. And so typically in cases like this, it's going to take months. And then while they're doing this, oftentimes what they'll do is they'll wait till the end of the trial and then start crunching the data. In this case, they're doing that as the trials are going on. They're also ramping up production as the trials are going on with the hopes that they get that authorization and they can go ahead and start distributing it. And so there's a lot of things that are working different than they've worked in the past, and that's important to understand.
If you go to a hotel or rental property, should you take your own pillows?
So the question is, if you go to a hotel rental property, should you take your own pillows? Might not be a bad idea. The other thing you can do is you could call ahead to the hotel or rental property and say, what do you do, particularly with the pillows? How do you treat those? I know some rental companies, especially the home rental companies, they'll make sure that they have a guest over a weekend. They'll have a few days off before the next guest so they can clean everything. That can certainly help. But as you know as well as I do, that they mostly end up taking the pillowcases and clean them, not the whole pillows. And so definitely something worth thinking about. But I would call them and say, what are you doing to ensure that the whole place is clean, but particularly the pillows?
Can you get the flu if you get a flu shot? If so, how will a COVID-19 shot be any different? And this is a great question. Can you get the flu if you get the flu shot? And if so, how's the vaccine, the COVID-19 vaccine, going to be any different? Well, it's not. And there's a couple of things I need to explain first. Number one, there are two different ways vaccines work. One is they work by preventing you from getting the illness. And you can think about measles, mumps, those types of vaccines.
Those vaccines have been around, they've been fine-tuned, they've been redone, and it takes decades to get to the point where we get those vaccines that can actually prevent that illness. The second way they do it is they partially prevent the illness in some people, but more importantly, in people who get the illness, they prevent complications from the illness. They help them recover quicker. And that's what we think is going to happen with this first salvo of coronavirus vaccines. It might not necessarily prevent you from getting coronavirus, but it's going to help you prevent complications of coronavirus, and particularly dying from coronavirus. And what I typically talk about the flu, when it comes to the flu vaccine, is for years we talked about the effectiveness of the flu vaccine. And we talked about how it's usually around 50%. If we get 60%, we're very happy that the flu vaccine is that effective. That effectiveness is how effective it is at preventing you from getting the flu. But talking to experts last flu season, this was before coronavirus even came into the limelight, before this happened, I talked to them about the flu vaccine. And what they said is that we essentially have been doing everybody a disservice because we've been explaining the effectiveness as preventing flu. What they want to focus on now is explaining the effectiveness of how effective it is at preventing complications from the flu, at preventing hospitalizations, and more importantly, preventing deaths from the flu. It's the same thing with coronavirus. I think you're going to start hearing, instead of this vaccine is this effective at preventing you from getting the coronavirus, they're going to talk about how effective it is at preventing you from getting complications of coronavirus. And that's an important understanding. So the vaccine, even though it won't prevent you specifically from getting it, or it might not, it hopefully will prevent you from getting complications, which is extremely, extremely important.
Doctor, do you take the flu vaccine?
I get the flu vaccine every single year. And part of it's because I work in a healthcare system, so I need the flu vaccine. But the other part of it is because I want to make sure that I'm protected from the flu. And again, there have been a couple of times, even with the vaccine, that I've gotten the flu. Mainly because I work in a hospital, I work with people who are coughing and sneezing in my face when they have the flu. And so even though I've gotten the flu, I haven't been wiped out by the flu. I haven't had those hard symptoms, but I have had positive flu. So I know the vaccine has protected me at that point. On top of that, the more you get the flu vaccine, we're finding out, the more likely it is to protect you from subsequent flus because your immune system gets primed to fight those flus off. And so that's important. Plus, as we get older, it's more important to get the flu vaccine because it can protect you from the complications of the flu, which are more likely as we get older, and particularly pneumonia from the flu, which can be devastating and even deadly. So yes, I get it every single year. I'll be getting mine. Today's September 4th. I'll be getting mine in probably about 2 weeks.
How does the flu have a season? How does it just show up?
So how does the flu have a season? Why does it just show up? And this kind of lends itself towards coronavirus. How's that different or the same? The reason the flu has a season is because the flu circulates around the globe. The flu is a winter virus, and the reason it's a winter virus is for a couple of reasons. One, it's more active. The virus itself is more active in the winter. Number two, people tend to move indoors, and so they're closer together, which we found out through coronavirus can be a great way of spreading these viruses. And number three, we tend to have coughs and sneezes and runny nose, and so we're constantly wiping our face, touching other surfaces, and so it can spread that way as well. The reason we have to get a flu shot every year is because the flu itself changes enough to where the prior flu shot isn't as effective as we'd like it to be. The flu is very tricky, and it does this. It constantly mutates as it's circulating in the globe. And so what they typically do is they look usually in China or Australia come April time frame and see what's cropping up there, and then they make a decision on what flu strains they think will be here. So even though you hear there's an H1N1 strain, it's a little different than last year's H1N1 strain. And the spikes if you remember coronavirus, it's a ball with little spikes on it. Flu's like that as well. Those spikes are what latch onto our system and to our cells, and those spikes can change enough to where what we had last year to protect us from it, to activate our immune system, won't necessarily work as well this year. Coronavirus, we think it's not going to change quite as much, and that's what we've noticed over the last few months. It's been slow to change. It has changed because that's what viruses do, but it's been slow to have any changes, and we haven't seen any major changes that would indicate we need a different vaccine. So the hope is that this virus is one that we can get one shot, maybe a booster shot later on. We won't know for a few years because it might be that we actually have to get a shot every year along with the flu shot. But the important part is that they're keeping an eye on this to see if it does change. So far, it doesn't have any indications that it has, and that's the important thing.
What about zinc? Does it help with COVID?
So there were some interesting studies early on, or interesting anecdotes more about zinc and how it might have helped. The reason we're saying that is because we know it can help with certain things, but you do have to be careful with zinc. You don't want to take too much of it. There's been nothing to show that it's effective at preventing you from getting coronavirus or lessening complications of coronavirus. And so to date, the things we know that help are what I call the 4 W's. Wear a mask, watch your distance, wash your hands, and windows. Opening windows to get that fresh air in, to circulate that virus out of the environment you're in. But as far as taking zinc or supplements or anything like that, the best thing you can do is make sure that you eat healthy, you exercise, you do those things we know that we need to do in order to stay healthy, because that keeps our immune system healthy, and that can certainly help out. But thank you again. These have been fantastic questions. And again, going over the headlines real quick, vaccines. It looks like we're getting towards the emergency use authorization. There's some confusion as to when it might be. And what a lot of researchers are saying is we need transparency from the government in order to make sure that doctors, researchers, other experts can get an understanding of how safe and effective it is. And then we can get the message out to you guys about its safety and effectiveness with a good understanding of the trust behind the system. Colleges. Right now, the advice is colleges should keep college students, especially if they're sick. You don't want to send them home. You don't want to send asymptomatic students home who might have coronavirus. They could certainly spread it that way. And then the Labor Day weekend. Please avoid those large crowds. Please make sure you wear a mask and you social distance. And like I've been saying constantly, please have a healthy weekend, but do it in a safe manner to keep you, yourself, your loved ones, and your community as safe as possible. Thank you. Have a fantastic weekend and a great holiday.